Thank you, Chairman Wyden, for having me, and Ranking Member Crapo, and members of the Senate Finance Committee for having me here today. My name is Kaitlyn Joshua, and I'm from Louisiana. I'm here to talk about my own experience under extreme abortion bans in my home state soon after the Supreme Court eliminated the federal right to abortion care more than 2 years ago, and the problem these laws caused me and continue to cause other pregnant Louisianians and their families. You see, I was turned away without care twice from 2 different emergency rooms in Louisiana while experiencing a painful and potentially dangerous miscarriage. This was 2 summers ago. My husband Landon and I were already parents to a curious and happy 4-year-old daughter when we found out I was pregnant again. We were thrilled. At least to us, this was the perfect time to add a second baby. But this time, Louisiana's new abortion ban affected my pregnancy from the very start. When I called to schedule my first prenatal appointment, I was told I would have to wait until I was 12 weeks pregnant, a month longer than my first pregnancy. I asked, if this was because of the Louisiana abortion ban, and the young lady was very candid. She said yes. Because of the abortion ban, prenatal appointments were purposely scheduled weeks later than normal, delayed further into pregnancy when miscarriages are less common, to avoid potential legal and criminal liability for medical providers. Practically overnight, these laws were already compromising healthcare for all pregnant patients. Aside from experiencing some mild cramping and spotting, my second pregnancy was going along okay until around 11 weeks, just 1 week shy of that first prenatal appointment. I started bleeding while also experiencing pain worse than childbirth. My husband was at work at the time, so I drove myself to the emergency room. There, the medical team evaluated me and told me that my fetus had completely stopped growing. I realized I was having a miscarriage, but because of the state's abortion ban, the healthcare team wouldn't even say the word. They sent me home telling me that they would pray for me. The next day, the bleeding and pain got worse. I did not want to go back to the same hospital that I had been turned away the day before, so I met my mom and husband at a different hospital. I was losing so much blood at this time, even the security guard knew to put me in a wheelchair. The standard treatment for a miscarriage, what I was experiencing, is exactly the same treatment as abortion care, to empty the uterus by prescribing pills or a procedure called a D&C. It is an abortion. Yet in the second hospital, the staff told me we're not doing that right now and told me to go home and wait. Ultimately, it took me weeks for me to pass my pregnancy at home on my own without medical care, and I was absolutely terrified. This experience has made me see and realize how Black women like me die needlessly in and around childbirth. Since telling my story, I've received hundreds of letters from women across Louisiana who have had similar experiences, and we know routine and potentially life-saving medical care is being denied states across the country. And I've met so many other women who are also suffering because of abortion bans like others in Louisiana. 22 states have banned all or most abortions, and several states have criminal penalties for healthcare providers. As a result, doctors and other healthcare providers are afraid to treat patients who are miscarrying. And that's why women like me are being denied the dignity of basic, essential, time-sensitive healthcare that saves our lives, abortion care. Capable and caring physicians simply cannot practice medicine based on their training and expertise, and of course, the Hippocratic Oath. We're simply asking for, yet still being denied, the most basic level of maternal health care. Sharing my story is not fun, nor is it easy. I don't like being away from home. I have 2 children now, and part of me would like to forget the weeks of trauma I endured. But I know that I have to speak out. I owe it to those women who wrote to me, who have met in person, for women who look like me, and for women who don't. This is certainly an attack and an affront to our most basic fundamental rights: life, liberty, health, happiness, self-determination. This is government and political interference in private healthcare decisions. How is that okay in a freedom-loving country in 2024? Again, thank you for having me today.